Hello, dear students. In the lecture series of chemotherapy, we are discussing the general principles of chemotherapy, and after discussing the terminologies, then different ways of classifying antimicrobial agent, then bacterial drug resistance, superinfection, now a very important topic, that is, we are having a different antimicrobial, a vast group of antimicrobial agents, not for a different infectious condition, but even for a particular infection, we are having many choice. And how to select amidst a particular group and in this a particular agent is a very important point for the successful treatment of infectious condition. But then one immediately think that if there is an infection, you identify the microorganism, then you select the most effective drug and then you prescribe that drug. But dear friends, it is not as simple as it seems to be. Say for example, there is a sore throat. It is a symptom. There must be some upper respiratory tract infectious conditions. Now these infectious conditions can be of bacterial in origin also, and it can be of viral in origin also. Again in the bacterial in origin, it can be because of the streptococci or pneumococci or many other microorganisms. So, just by looking at the condition, you cannot directly jump to the conclusion that it is due to this microorganism and then you follow this pattern. Fine. Same way in the case of the meningitis. Now meningitis is also caused by various microorganisms. Okay? Then same way in the osteomyelitis. But here I don't want to convey the message that any particular, or we can say that I don't want to say that each infectious condition can be caused by different microorganisms. Yes, it is true, but it is for certain infections only. At the same time, there are certain infectious conditions in which it is caused by a specific microorganism, and additionally the clinical picture is such that you directly jump to the conclusion that yes, it is this condition, it is caused by this microorganism, and this is the particular antimicrobial agent which is most effective. Say for example in the syphilis, the clinical picture of the syphilis is such that one can easily come to the diagnosis that it is the syphilis, and we all know that it is caused by Treponema pallidum and penicillin. Penicillin is the group of the drug which is most effective. Okay? Now, as I have repeatedly told that we have to, say for example, in the bacterial meningitis or osteomyelitis, then we have to first identify the microorganism. Then the question arises in your mind that what is the harm in identification of the microorganism before starting the treatment? There are certain concerns. Say for example, the diagnostic test that is not easily available yet in every setup. That is the first point, availability of the specific diagnostic test. Then second, time. Many a time, even if this diagnostic test is available, then the time doesn't permit. We cannot wait for the laboratory result. And third is the cost. For each and every condition, say for example, you just think that for each infectious condition, can we go for or can we afford the culture and sensitivity report? Then the answer will be No. So, dear friends, I want to tell that there are many factors. There are many factors which will govern the selection of antimicrobial agent, and that we will discuss in this class. But broadly, these factors can be divided under the three headings, and first is the microorganism related factors that will govern. Second is the patient related factor, the characteristics of the patient. Okay, suppose if the patient is of pediatric age group, our selection is different, and patient is of geriatric age group, our selection may be different. And third is definitely, say for example, you are having a 4 different antimicrobial agent available for a particular condition, then you have to select a particular antimicrobial agent based on the safety, effectiveness, cost, pharmacokinetic profile, and many more. So, in nutshell, we will discuss these governing factors for the selection of the antimicrobial agent under these three headings: microorganism related factor, patient related factor, and drug or the antimicrobial agent related factor. Okay, so now first we will discuss the patient related factors, and in this the first and foremost is the age. Now in the age there are certain pharmacokinetic I would say the characteristics or the limitations of the age group that will affect the choice of the antimicrobial agent, and there are certain age related specific adverse drug reaction of the antimicrobial agent. I am explaining you these 2 points by giving a specific example. Like first and foremost is the pharmacokinetic characteristic. Okay, now there are certain agents, say for example the chloramphenicol. Chloramphenicol is primarily metabolized. It is conjugated inside the liver, and this glucuronide conjugation capacity, you all know that in pediatric age group, especially in the infants, it is limited. So if you give the chloramphenicol in the infants, it will lead to grey baby syndrome. Okay, now as I told you that age related specific ADRs, like you all know that our renal function declines with the age, GFR reduces with the age, and there are certain antimicrobials, for example aminoglycoside antibiotics. Their excretion is primarily parallel to our kidney function, and so the aminoglycoside elimination reduces, and that's why in elderly the aminoglycoside side effects like the nephrotoxicity, vestibulocochlear toxicity, it is increased in the elderly. Okay, same way tetracycline. Tetracycline has a specific characteristic to deposit in the developing teeth and the bone. So these adverse reactions is seen only in the pediatrics. So we have to take care while selection of the antimicrobial agent, this age factor. Second is the pregnancy. Okay, now it is a very blanket statement that as far as possible avoid any drug during pregnancy. Okay, the same applies to the antimicrobial agents also. But if there is any systemic infections develop and there is a need of the antimicrobial agents, we have to select either from the beta-lactam group. Penicillin group is the safest one, then some cephalosporins and erythromycin. But there are certain antimicrobial agents which are absolutely contraindicated during pregnancy. As I told you, the tetracycline, which is causes hepatotoxicity, kidney toxicity, then aminoglycoside antibiotics. These agents must be avoided during the pregnancy. Then associate comorbid conditions, especially the organ of the elimination, like the liver and the kidney. If these organs are damaged, one should be very cautious for prescribing the antimicrobial agent which is primarily eliminated by that organ. Say for example, if you have come across a patient who is having a gram-negative infection and you know that the aminoglycosides are very effective, but the patient is having kidney failure, then you should not prescribe the aminoglycoside, because aminoglycosides are primarily eliminated from the kidney. But if you are not having any other choice and the condition is grave, then you can select the aminoglycoside, but you have to take this point in your mind and you have to decide the dose accordingly. Okay? Same way in the hepatotoxicity. If a person is having hepatic damage, raised hepatic enzymes, and you have to prescribe a drug which is primarily metabolized by the liver, like the rifampicin or isoniazid, then you have to be very cautious. Better to switch over to other drug. Fine. Then another important point is the immune status of the individual. You all know that the infection is there because our body's defense mechanism is somewhat compromised. Otherwise, if the body's defense mechanism is competent, it will try to fight with the microorganisms. Okay? But if the microorganism load is very high, then even if the person is immunocompetent, but still there is a development of infection. But here what I want to suggest is, if you know that the person is immunocompromised, and say for example, if the person is having a diabetes or the person is having acquired immunodeficiency syndrome, or if the person is taking a cancer chemotherapeutic agents, or if the person is on corticosteroid therapy, these are all the conditions in which the immune system is greatly compromised, and in this you have to give the bactericidal agent. While at the same time, if the immune system is competent and infection is not the serious, one can give the bacteriostatic agent also. Now, after the immune status, a very important point is the local factor. Many a times the failure of the response to the antimicrobial agent is because certain local factors are not considered. And most common is, if there is any prosthesis or device or implants, the reach of the antimicrobial agent is significantly compromised, like the catheter. Okay, the reach of the antimicrobial agent to the infectious site, it is significantly compromised. Same way in the case of necrotic material. Then if there is any barrier, say for example, if the subacute bacterial endocarditis, the antimicrobial agent will not reach to the target site, and if it will not reach to the target site, how it will produce its action? So, these are the certain points that is a barrier and which prevents the reach of the antimicrobial agent at the target site. Then many times the site is the inaccessible, and one important point here I want to say that the presence of pus and the secretions, it will reduces the action of certain antimicrobial agents. Many a times, because of the pus and because of the lowering of the pH, certain antimicrobial agents, say for example the aminoglycosides, they are not effective. Okay? And if a drainage of the pus or the secretions has been done, then there are two advantages. One is the microorganism load of the microorganism significantly reduces, and that can be dealt with the antimicrobial agent. And second that because there is an exposure to the air, exposure to the oxygen, now the anaerobic organisms cannot survive. And this is one of the biggest limitations in the anaerobic environment. Okay, that many a times, if say for example in the center of the abscess the environment is anaerobic, and this anaerobic environment, it will hamper or it will inhibit the certain bacterial transport processes, and the transport process is responsible for the entry of the antimicrobial agent. And that's why if the environment is anaerobic, again the antimicrobial agents will not reach to the target site and produces its action. Hematoma. Hematoma will not only foster the bacterial growth, but it will limit the entry and the effectiveness of the antimicrobial agents. So if you just look at all these local factors, then you come to know that the major limitation with the local factor is either the antimicrobial agent will not reach to the target site, or even if it reaches, its concentration is very less or it becomes less effective. So if at all possible, one has to take certain measures to avoid this local factors limitation. Then history of drug allergy. This is very, very important. You know that one of the safest antimicrobial till today, which was developed the initial antimicrobials, and still today it is the most safest, and that is penicillin. But one of the biggest limitation of the penicillin is in very few individuals, it will cause development of anaphylactic reaction. Now suppose you have not taken the drug allergy history, and if the patient is allergic to the penicillin, and suppose you have prescribed the penicillin for a gram-positive infection, say for example the streptococcal throat infection, and if you have prescribed this drug on an OPD basis, and if the patient reaches to the home, take the drug, and if the patient develops anaphylactic shock, then it will be nearly impossible to survive the patients. Patient can definitely be survived if you have not treated the sore throat because of the streptococci, but patient cannot survive because of the anaphylactic shock. So what I want to say, to explain you the gravity of this condition, that history of drug allergy is must. Okay, and there are certain antimicrobial agents like the penicillin group, cephalosporin group, sulfonamide group. All these are known to cause the drug allergic reaction. And last but not the least, that is genetic factors. You know that there are certain individuals in specific communities, there is a G6PD deficiency, and as like the other drugs, with the antimicrobial agents also, that in case of G6PD deficiency, if you prescribe this antimicrobial agent, there will be development of severe hemolytic anemia. And these drugs are primaquine, then sulfonamides, then chloroquine. So one should be cautious while prescribing this drug. So in short, these are the different patient related factors that one should consider before selecting a antimicrobial agent. These are age, then pregnancy, then hepatic and renal function, immune status, local factors. In the local factors, the pus, secretion, prosthesis, device, necrotic material, barrier, hematoma, and anaerobic environment. Then history of drug allergy, and finally the genetic factors. In the next class, students, we will discuss about the microorganism and drug related factors that will govern the selection of antimicrobial agents. Thank you.